So we have a newly registered nurse like you a few days from now who is assigned to conduct a lecture on fertility awareness among young women. So for the situation, so that's talking about fertility awareness. So we have one participant asked, when does ovulation take place? So what will be your reply with regards to this question? Okay, so going back, so fertility, one of the participants asked, when does ovulation take place? So as I recall, so yung ovulation natin, of course, so let's start, of course, in the process of menstruation. So we have, okay, the different phases of menstrual cycle that we have. The first onset of menstruation, as we all know, that is considered as the term for that is your menarche. Okay, so we have during adolescence, of which our brain is sensitive, talking about hypothalamus, sensitive to the increasing or decreasing level of your estrogen and progesterone that triggers the release of your gonadotropin releasing hormone that we have. So let's start on the process talking about, because menstruation, as we define, this is a periodic, okay, a periodic uterine bleeding that we have. Periodics are talking about, okay, it is a cyclic bleeding. Okay, it's a monthly bleeding that we have, and we used to start, of course, during our menstruation or the menstrual phase that we have. Ang ganda ng sulat ko. Okay, that's menstruation. Okay, so we're talking about menstruation or the menstrual phase natin. And that menstrual phase usually is 1 to 5 days natin. That's 1 to 5 days. 1 to 5 days. And 1 to 5 days of talking about your menstruation, okay, anong nangyayari? So there is a usual blood flow that accounts almost 30 to 80, okay, 30 to 80 ml of blood loss, okay, na very important for an adolescent or yung menstruating client to have this iron supplementation. After this menstrual period, okay, during this period, what happened? There is increase or decrease level of estrogen and progesterone. During the menstrual phase, so basically, we will expect that there is decreased level of estrogen and there is decreased level of your progesterone. So what will happen with this decreased level of estrogen as well as your progesterone? With this increased level of estrogen and your progesterone, that's the time that will stimulate your hypothalamus, okay, the hypothalamus to release gonadotropin releasing hormone or the GnRH that we have. And this gonadotropin releasing hormone natin, okay, will release specifically the anterior pituitary gland, okay, our APG, okay, the anterior pituitary gland to release. Okay, ano yung mga hormone na nire-release ng APG natin or the anterior pituitary gland? We're talking about the follicle stimulating hormone, and another hormone released by your APG, it's the luteinizing hormone. Okay, so you have the luteinizing hormone as well as the follicle stimulating hormone. And what are the role of this follicle stimulating hormone? So follicle is stimulating hormone. It will stimulate the follicle. So we're talking about the primordial follicle that will start the process of maturation. Okay, so the follicle stimulating hormone, okay, starts the maturation of our, okay, primordial follicle. Okay, primordial follicle to our, okay, Graafian follicle that we have. And then during this period, okay, so during this period, the Graafian follicle, ano nang mataas yung, there is, ano nang nandito, we are talking about the increased estrogen in here. Okay, and as increasing level of estrogen, we're talking about the, okay, the proliferative phase. Okay, the proliferative phase of the menstrual cycle, and this is otherwise known also as the, okay, other term for this one is the estrogenic phase. Estrogenic phase of the cycle, because it is where you have increased level of your estrogen that we have. And then how about the function of this luteinizing hormone? This luteinizing hormone, sabi natin, okay, luteinizing hormone, this luteinizing hormone is responsible for the final maturation of the Graafian follicle. The final rupture or maturation of this Graafian follicle. And that maturation or the final rupture is what we term as your ovulation. Is what we term as your ovulation, of which a woman used to experience, okay, metal smears that we have. The metal smears, it's the pain, unilateral pain experienced by woman, or the periodic pain experienced by woman, brought about by the rupture of the Graafian follicle as influenced by your luteinizing hormone. As influenced by your luteinizing hormone. So going back to the phases of menstruation or the menstrual cycle that we have on the proliferative phase, okay, that is usually 6 to 14 days natin. 6 to 14 days. Okay, so talking about the menstrual cycle on the first day of menstruation, okay, on the first day of menstruation, so sa proliferative phase natin, so meron na ba tayong ovulation? Okay, ovulation usually, 14 days, talking about in a normal 28-day cycle, on a normal 28-day cycle, usually on the, kasi nga during this period, we're talking about the secretory phase, from 15 to, 26 days that we have. So, prior to the ovulation, or the final rupture of the Graafian follicle as influenced by luteinizing hormone, there will be gradual, there will be, sudden drop of the temperature. That's sudden, it's not gradual. The gradual is talking about gradual increase in the body temperature as we are using on the basal body temperature or the BBT on a natural family planning method that we have. So there's sudden drop, and then you will observe a gradual increase. And what is the reason why there is gradual increase of this temperature of a woman na nag-ovulate? Kasi nga sabi natin, during the final rupture of your Graafian follicle, so what will happen now? So you have in here the, these are the remnants now. If this is now the mature ovum, we have now the remnants of the Graafian follicle, of which we term this one as your corpus luteum. We term the remnants of your Graafian follicle as your corpus luteum. And this corpus luteum is responsible for the release of your progesterone. So you have now increasing level of your progesterone. And what is the role of this progesterone? The role of progesterone, so alam natin the usual talking about estrogen. This is the hormone of women because we're talking about this is the hormone responsible for the secondary sex characteristic of women. And progesterone, this is the hormone, talking about maintenance of pregnancy. So hormone of pregnant women, talking about this progesterone. But how about during menstruation? This progesterone, sabi natin, this progesterone is responsible for, the secretion of mucin, amino acids, and preparations dun sa mayabong na endometrial lining of the uterus, and the preparation, if there is implantation, so that's the role of progesterone. And there is significant function of this corpus luteum. Because if there is no fertilization after the final, or after the ovulation that we have, what will happen? Kung merong fertilization, if there is fertilization, what will happen? The corpus luteum will continuously function, in producing your progesterone. Tuloy-tuloy siyang magtatrabaho na magpuproduce ng progesterone for the reason na there's no placenta yet that will provide this progesterone, to maintain the pregnancy. Until when? Until when? That's the question. Until the placenta is fully functional. So that's the time, of course, that the corpus luteum will atrophy or will stop producing this progesterone. You have to 12 to 16 weeks that we have until the placenta is functional, talking about the production of progesterone. But what will happen if there is no fertilization? There was no fertilization, so what will happen to the corpus luteum? So corpus luteum, as we all know, it will atrophy, it will become corpus albicans. So it will become corpus albicans that we have. So with that, okay, it will no longer produce progesterone. That what will happen? So nagkakaroon na tayo ng ischemic phase of our menstrual cycle. So you have the menstrual phase, the proliferative phase, the secretory phase, and the ischemic phase natin. If there was no fertilization happen. But if there is a question, paano malalaman ngayon na corpus luteum that there was fertilization? Makikimarites ba si corpus luteum? How this corpus luteum, because it can possibly cause early miscarriage if there was fertilization happen and the corpus luteum failed to continuously produce progesterone. That can be a possible cause of early miscarriage that we have. And that is now the role of your human chorionic gonadotropin. That human chorionic gonadotropin, okay, present, okay, once there was fertilization, in our bloodstream, of course, will stimulate the hypothalamus to inform the corpus luteum. With the presence of HCG or the human chorionic gonadotropin, siya yung magsasabi kay hypothalamus, so tell corpus luteum that there was fertilization and this corpus luteum magtrabaho siya until that time that the placenta is ready to take over its function. So that's the time. Okay? So significant hormone also for the corpus luteum to produce continuously with your progesterone is the human chorionic gonadotropin. And that's the one hormone that will give us, of course, a positive pregnancy test through the urine. Because that presence in the bloodstream as early as on the 3rd day after our fertilization. Okay, earlier than the corpus luteum will atrophy if there was no fertilization. Because 4 to 5 days, if there was no fertilization, this corpus luteum will atrophy and it will become the corpus albicans that we have. That causes, of course, okay, the proliferated endometrial lining basically starts to shed off. That causes rupture of minute capillaries again. That causes our menstrual bleeding or menstrual flow. Therefore, so when is the best time that ovulation take place? Okay, so here are the options. Based on the knowledge or the recall, talking about the menstrual cycle. Okay. So here are the options. As soon as her menstruation stops. Okay. So please, I want you to type in your answer. I want you to type in your answers. Then I will check. Okay. I'll be giving later. Okay, ano ba ibibigay ko? Buho ko na lang para mas lalong kumonte. Okay? So I'll be giving my hair, okay, and my nails, okay, as a prize later. Kung may makaka-perfect sa lahat ng questions ko, okay, I will not promise pero I'll give something. Okay, baka virginity ko na lang. Okay, depende sa mananalo. Okay, so we're talking about, okay, as soon as her menstruation stops. So kaya nga kailangan natin, if you are in doubt of the questions, okay, so we are going to cover the options in order, okay, not to be distracted with the options para makapag-isip muna tayo. As soon as her menstruation stops, letter B, on the 14th day of her cycle. Okay, letter C, we have on the 14th day before the next menstruation. And okay, letter D, at the time her basal body temperature drops steadily. Okay, so these are the options. One of the participants asked, when does ovulation take place? So Kinab, a newly registered nurse like you, okay, answer will most likely be letter A, kindly type in your answer, as soon as her menstruation. Letter B, on the 14th day of her cycle. Letter C, okay, on the 14th day before the next menstruation. And letter D, at the time, okay, her basal body temperature drops steadily. Okay, I'm receiving some answers. Okay, madaming letter C, some answer letter B. Okay, walang sumagot letter A, walang sumagot ng letter B. Walang sumagot. Okay, so we will remove letter A and letter D because steadily drops steadily. So basically, walang ovulation doon kasi what is the function? Thermoregulation also is one function of progesterone. So kailan nagkakaroon ng level ng progesterone or the presence of progesterone happen once there was ovulation. So pag nag-rupture, that's the time that corpus luteum will start producing progesterone. So basically, for an ovulating client, hindi mababa yung temperature. There is a gradual increase in the body temperature. So remove letter D as well as letter A. So the options are talking about on the 14th day of her cycle and on the 14th day before the next menstruation. So going back to our discussion earlier, talking about the proliferative phase, and then from the menstrual phase and the estrogenic or the proliferative phase that happens on the 6th to 14th day that we have, meron na bang ovulation doon? Okay, so the higher, mataas na level kay estrogenic, it's the presence of estrogen. So wala pa tayong napag-usapang progesterone. It means to say, okay, talking about on the 28th day, okay, you have the, very good, for those students who answer, the 14th day before the next menstruation that we have. On the 14th day, okay, before the next menstruation. So that's the best response talking about the ovulation. Another situation. Okay, so you can type in your questions if you have some questions later. So we will address the question, type the questions in the chat box, and I will read and answer that before the end of our discussion. Okay, so we have situation, Jelay Ocampo, a 28-year-old bank teller consults the company nurse due to missed menstrual period for 2 months. She feels nauseated, especially in the morning, and suspects that she is pregnant. Okay, so alam na natin what causes the hormone. Okay, the hormone that causes this nausea and vomiting during pregnancy, it's your human chorionic gonadotropin. This human chorionic gonadotropin. Okay, human chorionic gonadotropin is the hormone. And then, okay, we have a lot of, okay, physiologic changes that may occur during pregnancy, aside from nausea and vomiting. But nausea and vomiting, if it may progress towards the 5th month of gestation, and increases, of course, the episode of vomiting that we have that predispose our patient to experience problems such as fluid and electrolyte imbalance. Okay, so you have that hyperemesis gravidarum. Hyperemesis gravidarum. And another one, if, okay, talking about hyperemesis gravidarum, we might suspect also that the patient has hydatidiform mold. That's another manifestation. Okay? Kung suka ng suka yung pasyente natin, plus other manifestations talking about the rapid growth on the uterine size, the absence of fetal movement, the absence of fetal heart tone. Okay? So we might suspect that the patient is having that, okay, hydatidiform mold. But we're talking about a normal pregnancy in here. So there is nausea in the morning and she suspects that she is pregnant. Okay, so yun yung problema ni Jelay Ocampo. Nakialam tayo sa problema ni Jelay. Okay, so this is now the situation. She asked the nurse what measures to take in order to cope with her nausea and vomiting. So nausea, which of the following will be the nurse likely to include in her teachings? So ang dami natin. Of course, you can have on the first trimester, we have, aside from nausea and vomiting, you can have fatigue. You can have also frequency in urination. Frequency in urination is common during the 1st and the 3rd trimester of pregnancy. Okay? Because of the pressure the bladder brought about by the gravid uterus that we have. So common on the 1st and the 3rd trimester. But very important that we need to ask also as part of our nursing responsibility, we need to ask the patient, okay, other accompanying signs talking about, okay, painful urinations to determine if the patient has, okay, urinary tract infection or hydronephrosis that we have, or cystitis, okay, kasi they are prone, of course, as part of the physiologic changes, okay, is concerned. Another one, ano pang mga possible? So you can have also this constipation. The constipation is brought about by, okay, we're just taking a glance talking about the changes or the physiologic changes during pregnancy. So we have constipation is brought about by your progesterone, okay, that slow the peristaltic movement that we have that causes too much absorption of water, okay, that predispose our patients to have this constipation. So the ambulations, increased fluid intake that we have, high fiber in the diet, those are usual nursing responsibilities natin. How about frequency in urination? We used to advise the patients to have limit fluid intake late in the afternoon. That is our nursing responsibility, late in the afternoon. So, umaga, mas madaming fluid intake. Pag maghabi na, kukunti na lang dapat because according to the research, okay, this frequency in urination experienced by pregnant women at night predispose the patient to experience fatigue. So in order to eliminate fatigue, we need to improve the sleeping pattern of our patients by decreasing the episode of urinations at night. Okay, so going back in here, so another, talking about nausea and vomiting, kasi sinasabi natin, okay, this is brought about by the human chorionic gonadotropin or the HCG that we have. So what's the usual intervention? Ito yung mga commonly asked questions in our board examinations, and I know that you know the answer very well. Kahit hindi pa magbigay ng options, these are questions that you know very well. Okay, limit water intake to 3 glasses per day. Okay, limit water intake to 3 glasses per day. So it's not a good interventions, even talking about the frequency in urination. Kasi nga ang problema natin, kailangan madami din fluid intake yung client natin. Except for patients with, okay, cardiac problem that we have. Talking about the pulmonary congestion. Okay. You have also to drink carbonated beverages before bedtime. So carbonated, okay. So we have issues concerning carbonated beverages that we have that predispose also, even a non-pregnant client, predisposed to have urinary tract infection. Aside from the hydronephrosis experience with this patient, taking this carbonated, that doubles the risk of having the urinary tract infection. So we used to discourage this, aside from the sugar, okay, and other complications brought about by this carbonated beverages during pregnancy. And then we have also take hot meals at hot milk at breakfast, and another one is eat dry and salted crackers before getting up in the morning. So kindly type in your answer. Okay, very good. Wala akong nakikitang mali yung sinagot. Okay, very good. Okay, so very good. Okay, very good. Kindly type in your answer. Okay, she asked the nurse what measures to take in order to cope with her nausea and vomiting, and which of the following will be the nurse likely to include in her teaching. Of course, okay, very good. The answer is letter D. Okay, eat dry and salted crackers before getting up in the morning, because the effect of the carbohydrates that we have, okay, it will decrease the secretions or secretions of your hydrochloric acids that we have, that will minimize the episode of vomiting or nausea and vomiting natin. But if the patient still nauseous a day, so we can advise also the ice chips natin in order to address the problem. But the best interventions in order to cope with this nausea and vomiting, eat dry crackers or unsalted crackers before getting up in the morning. Okay, next question. Okay, so next situation. So we have Mark, a 2.5-year-old boy, is health center a regular checkup. His mother tells the nurse that his child exhibits negativistic behavior, more so when he is tired, hungry, or uncomfortable. So we're talking about in here, we're talking about a toddler. A toddler, okay, of which very limited yung vocabulary. And the reason why the patient is talking about, okay, this patient used to manifest also, aside from negativistic behavior, because inability to express her emotion because of unlimited, or because of the limited words of vocabulary, used to have this temper tantrums. And then negativistic behavior, talking about negativistic behavior because in the psychosocial aspect, according to Erik Erikson, this toddler tend to have their autonomy versus shame and doubt. So as this toddler, develop, of course, the physiologic aspect, you have now the myelination of the spinal cord that we have, and that is our training. So the toddler, naisip niya, ay kaya ko nang i-control, yung anal and the sphincter, so we can start the bladder training of this patient. But anong nagiging effect nito? She or he wanted to control the world. That is when you ask the patient questions which are answerable by yes or no, so basically this patient used to have this negativistic behavior. No. And that is one way of developing their sense of autonomy. That's why as nurses or a primary caregiving, a caregiver dealing with this patient or dealing with this client, okay, so anong kailangan natin to address this negativistic behavior? Okay, we always have to provide, okay, choices to our patient. Okay, for example, if you want to ask this patient, okay, and be firm talking about this negativistic behavior, when you ask this patient, papakainin. Okay, it's not a good question when you ask this client, you want to eat the ice cream? Okay, no. Okay, it's a big no on their part. Okay, because they want to control you. That's part of their negativism because they want to develop this sense of autonomy. So what will happen? Of course, and what is the best intervention as a nurse talking about this one? So we need to ask, of course, it's time for you to eat. It's time for you to give definite instruction. Kakain ka na. Anong gusto mong gamitin? Itong platong pink o itong platong ganito? Si Barbie or si ano? Kabahan ka na. Lalaki yung anak mo, si Barbie yung piniling plato. Okay, so kabahan ka. So always provide options or choices also talking about for the client or this particular child address, okay, ma-develop, of course, yung autonomy. And that is our role. And then how about other concerns talking about the temper tantrums? On the temper tantrums, one of the highest priority assessment is to ensure the safety of the toddler. Ensure the safety of the toddler during the tantrums that we have. Kasi bakit nagtatantrums? Sasabihin kasi yung common natin, the tantrums is normal expression of stress by a toddler because of the limited vocabulary. Because they cannot, hindi katulad sa atin, daldal lang ng dal, katulad ko, so nailalabas lahat ng stress. But then, okay, napaka-limited ng vocabulary so they cannot express basically. So what will happen? Okay, they ended up having tantrums. So our priority is directed towards the safety of the patient. And the next thing that we are going to do, okay, aside from the safety, is to give definite instruction on what to do after the tantrums. On what to do after the tantrums. Okay, so if you are done, okay, talking about Mark, if you are done, so okay, you can go downstairs or you can, okay, kung anong instruction mo because it's time for us to eat after you're done. So alam ng bata because the child basically, it can end up to, okay, shame and doubt na after the tantrum, so what am I going to do? Okay, hindi naman po pwede, Mami, anong gagawin ko ngayon tapos akong umiyak? Okay, anong gagawin ko? It's our role as primary caregiver, our role as a nurse to provide instruction to the primary caregiver or to the mother, okay, to provide instructions or to give instruction to the child on what to do after the tantrums. And then talking about the play of a toddler, okay, that is usually a parallel play. So what is this parallel play all about? Talking about this parallel play, okay, they wanted to play side by side with another toddler, but sharing of toys, it's a big no-no to them. It's a big no-no to them. So do not expect, okay, napakadamot naman ng batang to. That's the beauty of research. Kasi kung hindi pa natin pinag-aralan yung growth and development, we might conclude, ano ka ba naman? Hindi naman ako madamot, ba't ang damot-damot mo? Ayaw mo mag-share. Without us knowing that that is the type of play that they want to enjoy. They want to play with another toddler, but sharing, it's impossible to them. Okay, so expect, so the best interventions in order not to have problems talking about kasi ang sa kanya, okay, ang laruan niya, it's a Barbie, ang laruan ng isa si Batman or whatever, the duplication of toy is one of our responsibilities talking about this parallel play for a toddler. So here comes the question talking about the toddler. Okay, for the toddler, no. Okay, so that's the situation. Okay, Mark, and the more he started hungry or uncomfortable. Okay. Na yung options natin. Oh, other way around. So Mark's mother asked how she can reduce or resolve his negativistic behavior. Which of the following will be least helpful? Okay, parents should. So kindly type in your answer. Letter A, accept negativism as a normal behavior. Least helpful. Insist in breaking the child's negative behavior. Be tolerant and respond in a regular, consistent manner. And letter D, avoid unnecessary demands. Mark's mother is talking about, we're talking about a toddler, okay, can reduce or resolve his negativistic behavior. Which of the following will be least helpful? Okay, the parent should, letter A, accept negativism as a normal behavior. And letter B, insist in breaking the child's negative behavior. And letter C, be tolerant and respond in a regular, consistent manner. And letter D, avoid unnecessary demands. Okay, this is another type. Okay, a board exam question. Okay, please type in your answer. Type in your answer. Okay, least helpful talking about negativistic behavior. Kindly type in your answer. Type in your answer. Okay, type in your answer. Okay, type in your answer. Okay, very good, very good, very good. Okay, so I'm receiving some feedback. Okay, very good. Okay, insist, insist. Okay, okay. Hindi yung insist, ha? Okay, insist. Okay, in breaking the child's negative behavior. Okay, okay. So everybody get the correct response and least helpful talking about we insist in breaking the child's negative behavior. If you are a parent full of insecurities also, so basically, ano ka ba? Akong masusunod, akong nanay dito, akong tatay dito. Bakit ikaw yung nasusunod? So do not break the child's negative behavior because that negativism is a normal behavior. What to do in order for the child? Kasi nga, naintindihan on the physiologic aspect, the very reason why the patient or the toddler tend to manifest that negativistic behavior because on the physiologic aspect, that's the time that they experience that myelination of the spinal cord that they can now control the rectal sphincter natin as well as the and then the urinations that opted the patient to have this kind of behavior. Okay, so least likely, okay, be tolerant and respond in a regular, consistent manner. That's very important also in dealing with negativistic behavior. Hindi po pwedeng paiba-iba tayo. Regular and consistent manner. And accept that behavior and avoid unnecessary demands. And of course, okay, always as part para mapasunod talaga natin. For example, when you are asking the child, okay, it's time for you to take a bath. So what you want to use the towel, the blue one or the pink one? Okay, kabahan ka nga kung pink pa rin yung pinili, tapos baby boy yung anak mo. Sige na lang, wag ka na lang kabahan. Okay, the next is we have another question. Another situation, this is Tony Flower. Okay, a 32-year-old primigravida at 39 to 40 weeks age of gestation is admitted to the labor room due to hypogastric lumbosacral pain. Internal examination revealed a fully dilated, fully effaced cervix plus bag of water and station 0. Okay, so fully dilated, so talking about the start of dilations that we have, talking about the true and false labor. Okay, so sabi natin true labor, so no matter what the activity of the mother, the pain will continue. And there is cervical effacement. Effacement should start first or come first before your dilatation. So effacement usually in percentage and complete effacement is 100%, and dilatation is usually described in centimeter, and complete cervical dilatation is 10 centimeter that we have. Okay, and then that complete that cervical dilatation and effacement natin predispose the patients to have a bloody show. What causes the bloody show is the rupture of minute capillaries because of the operculum, the formations of the operculum that will close the cervix during pregnancy in order to prevent close the cervix during pregnancy to prevent infection natin. And that operculum consists of Nabossian cysts, and during the process of effacement as well as dilatation, it causes rupture of your minute capillaries, of your Nabossian cysts that causes the bloody show that we have. So that's to differentiate. There is significant change on the cervix. The pain will continue no matter what the activity of the mother. And talking about the durations, later we'll discuss about the duration, intensity, as well as the the frequency of the urinary uterine contractions that we have. So positive bag of water and station 0. So we expect that this particular patient, admitted to the labor room, artificial rupture of the membrane is done. Fully effaced and still positive bag of water. Positive bag of water. So to determine, of course, positive bag of water, we're going to ano yung mga ways and how to check, of course, na kung pumutok na yung panubigan ng pasyente natin, we have the internal examination natin. For the internal examination, when we do internal examination, we need to ask, very important, is the episode or history of bleeding that we have. Because once there is bleeding, we are not allowed to perform internal examination because we might suspect that the patient is having placenta previa, and we might perforate the placenta when we do the internal examination. The rupture na yung membrane, or there is cervical dilatation that we have. Okay, but other ways to check the rupture of membrane natin is because the presence of fluid through the nitrogen test and the Ferning test that we have. Okay, the Ferning test as well as the nitrogen test. In this case, there was artificial rupture performed in our patient. Okay, which of the following nursing diagnosis is our priority? So artificial rupture, okay, we're talking about amniotomy. Okay, otomy or the amnion that we have, okay, amniotomy or the artificial rupture of membrane natin. Through the use of amnion, okay, nira-rupture yung bag of water ng client natin. And then, these are usually indicated for patients, ginagawa din naman natin to for patients na post-term na yung client natin and there is no signs of labor yet. Okay, so we do that because what happened with this, with the presence of amniotic fluid that we have, na hindi pa siya pumutok, okay, we might have problem talking about the uterine contraction. So, pag pinaputok na yung panubigan ng pasyente natin, so that's the time, of course, the patient also may have adequate uterine contractions leading to the expulsion of the product of conceptus. But this particular patient, since artificial yung sinabi natin, we use amnion, okay, so what would be your priority nursing diagnosis? So we assess the patients, we perform, okay, the artificial rupture was performed by the doctor. Okay, so the first, okay, high risk for infection related to rupture of membranes. Letter B, we have potential for injury related to prolapse of umbilical cord. Letter C, alterations in comfort related to increasing strength of uterine contraction. This is another board exam question. And letter D, anxiety related to unfamiliar procedure. Anxiety related to unfamiliar procedure. So again, artificial rupture of the membrane. So please take note that you should not, okay, exceed 1 minute in answering every question. Artificial, type in, okay, letter A. Okay, letter A, artificial rupture of the membrane is done. Which of the following nursing diagnosis is your priority? A high risk for infection related to rupture of membranes. Letter B, potential for injury related to prolapse of cord. And letter C, alteration in comfort related to increasing strength of uterine contraction. And letter D, anxiety related to unfamiliar procedure. So what is your answer? Okay. Okay, on the process of elimination, okay, because I saw different responses. Some of you answer letter A, some of you answer letter B. Okay, so walang pumili ng letter C and letter D. On the process, okay, anxiety related to unfamiliar procedure. Okay, there might be concerns, problem with regards to our communication if this anxiety will occur. Kasi nga dapat, we need to explain the procedure to our patients prior to every procedures that we are going to perform to our client. So, it may cause anxiety, but talking about this unfamiliar procedure, so kailangan, we need to educate the patients what to expect and what to expect talking about artificial rupture. So, buti walang pumili sa inyo ng letter D. And how about letter C? Alteration in comfort related to increasing strength of uterine contraction. Okay, though artificial rupture of membrane, kasi nga, with the presence, for example, talking about polyhydramnios, more than 2,000 ml of amniotic fluid, that polyhydramnios can cause hypotonic uterine contraction with the overstretching of the muscle of the uterus. So with the artificial rupture of membrane, the uterus can contract effectively. But the concern in here, okay, kasi that's all the normal occurrence during the course of labor. Though the patients will have these alterations in comfort as well. Okay, so remove letter C. That's expected, okay, for the patients to have alterations in comfort. But the main, okay, concern in here is the nursing diagnosis talking about the artificial rupture. So ang maiiwan sa atin is letter A and some of you answer letter B. potential for injury related to prolapse of the cord, and high risk for infection related to rupture of membranes. Okay, potential for injury related to prolapse of the cord. As we do amniotomy, okay, for example, talking about the microsomia, okay, the small for gestational age, talking about the polyhydramnios that we have, when we do artificial rupture, pag pinapaputok natin yung panubigan ng pasyente natin, there is a higher tendency also that the umbilical cord, okay, magpo-prolapse yung umbilical cord. And that's why the risk of that, okay, we put the patients on complete bed rest. Okay. But if you're going to go back on the situation, nasaan na ba yung pasyente natin? Okay? Balikan natin yung situation. Nasaan na yung pasyente natin? Admitted to the labor room. So kung nasa labor room na yung patients natin, fully dilated and fully effaced na, okay, so there is no risk talking about because the patients at this time, okay, hindi na natin papatayuin. So the risk of talking about this injury related to prolapsed umbilical cord because of the effect of gravity when you ask the mother to ambulate, as okay, talking about the premature rupture of membrane that we have, this potential for injury, it's very true for patients with premature rupture of membrane, with PROM that we have. But talking about the artificial, the best choice that we have is high risk for infection. High risk for infection related to the rupture of membranes. Because with the use of amniohook that we have, we introduce that amniohook that predispose the patients, of course, to have this infection also. Okay? Okay, moving on to the next question. Very good for those students who type in the reply, who actively participated with the questions. Okay, make it on the top, and this is the first and the last time that you are going to take the board examination. Okay, another situation. Alex Gonzalez delivered spontaneously to a live baby girl weighing 3,600 grams. Immediate postpartum care, partial care, postpartum care is done by the nurse assigned to her. Okay, so we're talking about the postpartum care. Okay, so sa postpartum, pag sinabing postpartum tayo, so ang lagi nating tatandaan, of course, in the physiologic aspect, okay, on the postpartum period, it will undergo the first phase of involution. On the first phase of involution occurred upon the delivery of your placenta, okay, the uterus tend to contract effectively in order to seal thrombi on the placental detachment site. Therefore, the uterus, you can find the uterus, if that's the question during your assessment, below the umbilicus that we have immediately after the delivery of the placenta, because that is the first phase of the involution process. Okay, so that's the first phase, and then aakyat siya doon sa level ng umbilicus, and 1 finger breadth per day yung decrease ng size, talking about the involution of the uterus that we have. And significant in here, okay, the client is at risk to develop bleeding. Develop bleeding on the postpartum period. What causes? It can be the early and the late bleeding that we have. For the early bleeding, one of the most common is the uterine atony. Uterine atony, inability of the uterus to contract effectively. Uterine atony is inability of the uterus to contract effectively. What are the factors? Any conditions for you not to memorize all those conditions. Any conditions that will cause over distension of the uterus. Multiparity, multiple gestation, okay, high macrosomia, and so on. Any condition, okay, para hindi ka na mag-memorize, that can cause over distension of the uterus can lead to uterine atony. Uterine, okay? Administration of anesthesia also can lead to possible uterine atony. Okay, so one of the highest is, okay, since yun yung problema natin na po pwedeng ma-anticipate in the postpartum period, is a frequent assessment with regards to, okay, talking about the vital signs of the patients, kasi that's vital. Talking about if there is profuse bleeding, if the patients will develop hypovolemic shock, so we might expect that there is decrease in the blood pressure, there is increase in the pulse rate, there is increase in the pulse respiratory rate, and there is decrease or the cold clammy skin that we have, because the blood tend to concentrate on the vital organs natin, that causes the cold clammy skin for patients who tend to develop hypovolemic shock. tend to develop hypovolemic shock. So napaka-importante, we need to check also the vital signs of our patients. And aside from that, basically, okay, to check, of course, the ability of the contraction of the uterus and other possible signs of bleeding on the postpartum period. So aside from atomy, the next possible cause of bleeding on the postpartum period we're talking about the lacerations. Okay, we have the lacerations. It can be vaginal lacerations, perineal lacerations, and of course, cervical lacerations. Okay, vaginal lacerations and cervical lacerations is very hard to repair. That will cause towards the mother as well as to the family waiting outside, that causes delayed discharge of the patients from the delivery room. That will cause anxiety on the part of the partner, on the part of the family. Bakit ang tagal? Nung una, ang bilis na naman. May problema ba sa asawa ko? Okay. Because of the problem talking about the repair. So, titingnan, paano natin malalaman that the patient has this problem? Once you have, when you assess the uterus, and that is, I will give you, okay, the uterus is well contracted, but there is still bleeding, okay, bleeding. So we might suspect that there is laceration. So for the lacerations nga, we have three types. It can be perineal laceration, okay, and on the lacerations natin in the perineal lacerations, it can be the first, the second, the third, and the fourth degree lacerations that we have. The first, the second, okay, ang pinaka-worst is the fourth degree. That includes, of course, the rectal mucosa, okay, of the patients natin. So to prevent that lacerations, part of responsibility during the course of labor is to perform, of course, episiotomy. And episiotomy is usually performed mediolateral or the median episiotomy. We have two types of performing episiotomy. Okay, you have the median and the mediolateral. If that is on the median, okay, okay, you cannot extend because that's directed towards the rectum. But the advantage talking about the median is the healing process. Okay, with regards to pain after delivery, okay, there is no dyspareunia. No pain during sexual intercourse postpartum if the repair is made, if the laceration or if the episiotomy is performed, the median one. The mediolateral, okay, the mediolateral, if this is the perineum, okay, the mediolateral, okay, this is the mediolateral, this is our median. Okay, the disadvantage of the the advantage by the way of the mediolateral, okay, we can extend. Okay, if we have problem delivering the head or the biggest part, which is the head, okay, we can extend, okay, but the concern in here is with regards to healing process, and then very hard to repair than the median, and then of course the patients may experience dyspareunia postpartum concern. So we're talking about dyspareunia or difficulty on sexual intercourse postpartum. Okay, so another possible conditions that we are going to check in the postpartum or immediate postpartum period, aside from lacerations, aside from, you can have also your the peripheral infections or the infections that we have as another concern is directed towards kasi increase in body temperature on the first 24 hours, if that's the question that you will encounter during your board examination, it's not our indication that the patient has infection. What causes increase in body temperature? Bakit tumataas yung temperature ni nanay pagkapanganak? It's because of, okay, the maternal exhaustion during the course of labor, as well as dehydration on the course of the labor process that we have. That causes increase in the body temperature of the patient. It's not an indicative of infection. How about the WBC on the postpartum client? WBC should not be used as indicator because of brought about by the traumatic delivery that we have that causes increase in the WBC. Therefore, WBC, it's not our indicator because that is normally increased on the postpartum period also. Okay, postpartum period. Okay, going back in here. Okay. So the first hour following the delivery is the most critical period for Alex Gonzalez. So which of the following intervention is a priority? This is another one board examination question. Okay, letter A, massage uterine fundus gently at the slightest sign of a relaxation. Letter B, we check the vital signs as often as necessary until they are stable. Letter C, administer oxytocics as ordered. And letter D, infuse intravenous fluid as ordered. Okay, so type in your answer. The first hour following the delivery is the most critical period for Alex Gonzalez. So which of the following intervention is a priority? Letter A, massage the uterine fundus gently at the slightest sign of relaxation. Letter B, check vital signs as often as necessary until they are stable. Letter C, administer oxytocics as ordered. And letter D, infuse intravenous fluids as ordered. Okay, so what is your answer? Kindly type in your answer now. Type in your answer. Less than a minute. Type in your answer and check for your priority intervention for the first hour postpartum period. Postpartum period, okay? Okay, magkaiba ka agad yung pumasok na sagot. Okay, kindly type in other students. Okay, just type in your answer. Okay, apply. Okay, then the process of eliminations. Apply, of course, talking about the nursing process that we have. Okay. How about the other students? Okay. Okay, type in your answer. Hello. Hello, hello. Okay, can you wave your license now? RN, RN. Okay, the first hour following the delivery is the most critical period for Alex Gonzalez. Okay, so some of you answer letter A and some of you answer, okay, let me check. The response, okay, may letter A and letter B. Okay, may sumagot ng letter D. Okay. So going back, okay. So in the process of elimination, if you will start with letter D, okay, some of you kasi the options now, okay, talking about the percentage with regards to the answers or the choices na pinili as letter A and letter B. So let's start on letter D and use intravenous fluids as ordered. Okay, that's part of our interventions. We continuously infuse, of course, as ordered. We monitor since the patient usually nga sabi natin nagkakaroon ng dehydration that causes increase in body temperature. Okay, and then intravenous fluid is very important. And then administration. So pero talking about the first hour, it's not our top priority. Okay, talking about kasi priority yung pinag-uusapan. Okay, priority yung pinag-uusapan. Administer oxytocics as ordered also. Okay, napaka-importante din na interventions in order to ensure the uterine contractions that we have. Okay, which of the following is our priority? So sabi nga natin kanina, okay, the question in here is our intervention. Okay, the intervention. How about letter A and letter B? Dato, massage the uterine fundus. Is checking the vital signs is another intervention? Yes or no? Yes, di ba? Sa interventions natin, check the vital signs every 15 minutes on the first hour and then as per hospital policy after the first 1 hour after delivery. Okay. So that's part of our responsibility and that's prioritized kasi and the problem on the slightest sign of relaxation, okay, and the slightest sign of relaxation and we do, okay, frequent fundal massaging to our patients, the patient or the uterus will no longer respond on that intervention. So what will happen? The patients may experience uterine atony. Okay, may experience uterine atony. The problem in here is the slightest sign of relaxation. Okay, so how about, sir, paano kung massage uterine fundus gently? Massage the uterine fundus gently. Okay, the patient is expected to have these oxytocic drugs in the postpartum period. That's why we really need to determine, okay, what are the possible complications or problems that your patient is experiencing by checking the vital signs. That's why standing order, every 15 minutes and the first 1 hour after delivery, we check the vital signs of the patients until stable or after the first hour. It depends on the hospital policy. So the best response talking about in here is letter B that we have. Boy, oh boy. Boy, oh boy. Okay, next situation. Okay, so we have baby will birth 2-day-old neonate delivered by normal spontaneous delivery. It's about to room in to his mother. Okay, so rooming in, that's part of our nursing responsibility. Okay, we are mandated by the rooming in law as well as the breastfeeding law in the Philippines. Okay, kaya nawala na yung mga nursery that we have. Ang naiwan talking about is the neonatal intensive care unit natin. This is of course to promote bonding natin. Okay, so for the question in here, we have Wilbert's mother asked how the cheesy substance covering her buttock, his buttocks talking. Okay, his buttocks and lower extremities can be removed. Okay, so with this question, we're talking about what is the cheesy substance? Okay, kindly type in your answer as a recall because I know that you know this very well. Okay, when dealing with our, okay, the vernix caseosa, very good. Okay, we're talking about the vernix caseosa and the vernix caseosa and the vernix caseosa and the vernix caseosa. So before in the old obstetrics, when you used to practice, okay, yung mga nagpapaanak pa ako sa community, nag-home delivery ako, okay, the usual indications talking about this vernix caseosa kasi nga yung mga false belief talking about this. Okay, the vernix caseosa na nag-sex. Hala, ang daming mga covering yung nag-sex siguro to sila. Kakaloka. Okay, paano nakarating yung sperm doon? Sarado naman yung cervix during pregnancy. So kahit kagaano pa kalakas yun, hindi kaya yatang butasin ng pressure ng pagputok ng sperm or during ejaculation. Okay, yung natawa si Mr. Distura. Okay, makapasok doon yung the sperm that will cover. So this is the vernix caseosa, that's the cheesy substance that we have. Okay, dati tinatanggal siya, nire-remove to the use of oil baths or the, okay, that we have. But nowadays, of course, which of the following is most appropriate advice of the nurse talking about this vernix caseosa? Okay, as I recall, apply baby lotion and gently wipe with a gauze and let it be removed this with alcohol and cotton balls. Okay, it shouldn't be removed. Very good, Adriana. Okay, use soft washcloths and baby wash and let it be allow it to remain in the skin because it is a protective coating that we have. Very good, very good. Kindly type in your answer. Very good, very good. Okay, you know this very well. Okay, that's part of the protective coating that we have to maintain the temperature because knowing, okay, the problem is, okay, the immaturity of the thermoregulation of the brain of the newborn that we have that will predispose aside from no subcutaneous deposition of adipose tissue that we have, no shivering effect talking about the cold that we have same as sa atin mga at meron pa tayo liban sa nagchichill tayo o pag sobrang lamig na meron pa tayong mga human blanket sila wala na kung nilagay mo na tapos na yung skin to skin contact. Okay, the human blanket naman nila of course is the skin to skin contact or the kangaroo care that we have. Okay, samantala nga tayo nag-skin to skin contact or nag-human blanket tayo pag sobrang lamig. Okay, how about them? So this is a protective coating that we should not remove, okay, as part of our responsibility because it can maintain, of course, okay, the reg. It provides insulation, okay, directed towards the newborn that we have because knowing that in the newborn we have a lot of, okay, causes of heat loss that we have. It can be through radiation, it can be through conduction, it can be through convection, it can be through evaporation that we have. That's why, okay, we really need to cover also aside from that, we cover the head of because that contributes a lot talking about the heat loss of the newborn. Okay, so very good. Well said. Lahat nakatama talking about this cheesy substance that we have. Another question, we're talking about the pregnancy-induced hypertension. That according to Melay, Melay is a 33-year-old, gravida 1 para 0 at 32 weeks gestation and admitted to the regional hospital with a diagnosis of pregnancy-induced hypertension. So this pregnancy-induced hypertension, kasi we have different categories talking about hypertensive disorder during pregnancy. And hypertensive, if the patient was not diagnosed with hypertension and developed hypertension during pregnancy, we used to term that one as no hypertension before pregnancy, but diagnosed with hypertension during that pregnancy, but no signs of proteinuria, no edema that we have. So that is considered as, what is your answer? What is your answer? Talking about the type of gestation, the type, sinabi ko na yung sagot. So talking about gestational hypertension. Gestational hypertension, so no history. That's why very important that we do, of course, history taking during the prenatal checkup to know or to determine if the patient has existing hypertension. Because if hypertension developed during pregnancy, okay, iba ang pangalan nun. Kasi kung meron na siyang hypertension prior to pregnancy, we use the term that condition as chronic hypertension. That's chronic hypertension. It means to say that the patient was diagnosed with hypertension even before the pregnancy. But if the patient was diagnosed with hypertension only during pregnancy. We have that gestational hypertension. Then to differentiate with this gestational hypertension to pregnancy-induced hypertension or the preeclampsia that we have, it's the presence of your proteinuria as well as the edema that we have. So hypertension, increase in blood pressure, you have proteinuria as well as your generalized edema, of course, will differentiate your pregnancy-induced hypertension. In the community, what we are going to do, okay, ang ginagawa ko when I was assigned before, when we are, okay, nandito may isa kong classmate, dalawa yatang classmate ko nakita dito. Okay, assigned when we were scholar ng Department of Health, the thing that I used to perform in order to determine the presence of albumin in the urine, that is, okay, through the heat and acetic acid test. Heat and acetic acid test, it is commonly asked question also during the board examination, okay, with the use, okay, nilalagay natin ng urine, yung test tube natin, of course, we have in our CHN bag, we have our alcohol lamp, we have our test tube, we have our test tube holder, and we have also our medicine dropper, okay? And then we fill 2/3 of the mother's urine, yung test tube natin, and we are going to heat that. Okay, yung heating, of course, alam nyo na to. Okay, in heating, okay, towards the end, ang pag-heat natin, kasi hindi po pwedeng nandito sa dulo, kasi, okay, lalabas lahat ng ihi pag nag-boil na yung urine. So, at the tip, of course, towards in here, if that's on 2/3, dito tayo mag-heat with the alcohol lamp, and after boiling, we will add, of course, 3 to 5 drops of urine, okay, of your, 3 to 5 drops of acetic acid, rather, okay, sa heated urine ng patients natin. If there is cloudy formations, so makikita mo talaga, okay, cloudy formations that we have, so that's the presence or positive proteinuria natin. And then to address the problem, talking about the pregnancy-induced hypertensions, because the danger in here, okay, before, the term for pregnancy-induced hypertension is toxemia of pregnancy. It's no longer used because the usual association, and again, that's the beauty of research, because usual association na ang sinasabing rason noon na kung bakit nagkakaroon ng pregnancy-induced hypertension, it's because of the pregnancy. So terminating the pregnancy will address the problem. Kaya tinatawag ng toxemia. But, okay, later on, they found out that even after the postpartum period, the patient will still experience pregnancy-induced hypertension, or worse, experience dyseclampsia. So nagkakaroon ng seizure. How are we going to differentiate preeclampsia to eclampsia? The presence of seizure will differentiate your pregnancy-induced hypertension as well as your eclampsia. So pag nag-seizure na yung patients natin, that's why our priority for patients with pregnancy-induced hypertension is to prevent the patient to experience, okay, or having this seizure natin. Therefore, there was one question in the board examination talking about pregnancy-induced hypertension. When you are going to admit the patient, okay, with pregnancy-induced hypertension, saan natin siya ilalagay? In a private ward, okay, sa ward, or sa ward, private room, or sa ICU natin ilalagay yung pasyente. Okay, so normally, in a private room natin nilalagay. Of course, private room, in order to diminish this, decrease, of course, for example, talking about the decrease natin yung mga stimuli directed towards the patients. Talking about, okay, dim light directed towards the patients, but as part of our nursing responsibility na hindi yung sobrang dilim naman na kailangan mo nang gumamit ng flashlight when you are taking the vital signs of the patients, because using the flashlight when you are taking the vital signs of the patients may trigger the eclampsia or the seizure of your client. Yung good enough, the lighting of the room of the patient is good enough for you to see also your interventions that you are going to render. Hindi mo na kailangan mo na nag-flashlight ka tuloy, okay? And of course, okay, a quiet and non-stimulating environment that we have, and that is the best choice, okay, that you are going to choose talking about the room assignment on this particular patient on pregnancy-induced hypertension. And of course, okay, you have this seizure precaution yung client natin. After that, on the seizure precautions, we know very well that we need to prepare, of course, diazepam that's the bedside, tongue depressor, of course, priority directed towards the safety. Always put the syros up that we have. Okay, so yun yung mga common nursing responsibility with regards to pregnancy-induced hypertension. And the drugs that is usually given to our patients, of course, is the magnesium sulfate natin, the mag sulfate for patients with pregnancy-induced hypertension. Okay, so the nurse knows that Melai is knowledgeable about the occurrence of pregnancy-induced hypertension when she remarks, okay, letter A, it usually appears anytime during pregnancy. Letter B, okay, so after if that's the question talking about PIH, and then, okay, emote ka ng emote muna ng emote, ano ba itong pregnancy-induced hypertension? So the first option, it usually appears anytime during pregnancy. The second choice, you have it's similar to cardiovascular disease. And letter C, PIH occurs during the first trimester. And letter B, PIH occurs after the 20th week of age of gestation. So in here we are talking the question in here, okay, it's the knowledge of the students. It's easy recall, talking about easy recall on the occurrence or the onset of, okay, pregnancy-induced hypertension. So kindly type in your answer. Kindly type in your answer, okay, knowledge level, talking about the occurrence of pregnancy-induced hypertension. Letter A, usually appears anytime during pregnancy. It's similar to cardiovascular disease for letter B. Okay, thank you, Christopher, for your answer. PIH, of course, during the first trimester, letter C. Rodolfo, letter C. Okay, Oragon talaga ining taga-Sursugon. Very good, Mr. Rodolfo. Letter D, pregnancy-induced hypertension. Okay, of course, thank you for your answer. Okay, pregnancy-induced hypertension, of course, after the 20th week. Okay, the ASIS. Okay, letter D is the answer. Okay, so what's the best reply? Okay, so in here, so we're talking about, it usually appears anytime during pregnancy. So hindi po siya kasi there is a delineation. Okay, then nag-sorry si Kuan. Sige lang. Okay. But of course, during the board examination, okay, the instruction is very clear. No erasure. So do not attempt to erase. Do not attempt to erase. There are cases talagang kaya nga kailangan talaga natin, we need to follow the sequence in answering the questions from the questions that we really know to the questions that you don't know. Questions that you really know to the questions that you're in doubt, and the last question is to the questions that you in doubt. You don't know. Okay, kasi nga very clear, so do not, okay, make any erasures or alterations with your answer during the board examination. So the correct response, because significant also, bakit tinatanong siya sa board examinations yung occurrence ng pregnancy-induced hypertension? Because if the patient will manifest sign of pregnancy-induced hypertension, ano nga yung sign of pregnancy-induced hypertension? We're talking about the presence of protein in the urine with the presence of your generalized edema as well as your hypertension or the increase in blood pressure. So kung yung tatlong yon, okay, present, okay, before, okay, during the first trimester, wag naman before the first trimester, walang zero trimester during pregnancy. Paloka ka nun. Parang ako lang yun. Okay, laging buntis na hindi naman nanganganak. Okay, so you have, okay, you may suspect that the patient, okay, may have what particular condition? Okay, early occurrence of pregnancy-induced hypertension before the 20th week of gestation is indicative of high DATD4 mole. Indicative of high DATD4 mole. So you need to check for another manifestation. Bakit nagkaroon ng ganito ang aga pa? Because this occurrence of your pregnancy-induced hypertension usually after the 20th week age of gestation. So after the 20th week of gestation, if that's earlier than that, okay, we might suspect na yung client natin is having also another problem such as your high DATD4 mole. So talking about, okay, on the proteinuria, in any condition during pregnancy, okay, proteinuria is considered as abnormal findings that we have. Okay, how about trace of glucose in the urine? Positive one trace of glucose in the urine is insignificant findings natin. So hindi siya abnormal findings for the reason that during pregnancy on the urinary system, the patient used to have this increase in glomerular filtration rate. The GFR increase up to 50% that causes the spillage of glucose in the urine that will give us insignificant findings of positive one glucose in the urine of a pregnant client. But it's not in the presence of your protein in the urine. Okay, so moving on to the next question. Okay, so we have Mrs. Gaza, at 26 years old, okay, consulted at the health center because of nausea and vomiting. She claimed that she missed her menstruation for 2 months and her LMP was, okay, March 1, or the last menstrual period of your client, March 1, okay, Of course, part of our other questions in the board examinations will ask you to compute for the expected date of delivery of our patients. And of course, we used to have this, determine the LMP of your patient, okay, para ma-compute natin yung ADC ng client. And then the ADC or the ADD, kasi nga, we used to have this ADD nowadays because there is no course of hospitalization or confinement during the course of delivery if it's uncomplicated pregnancy. So expected date of delivery. So the purpose of that is, okay, for us to be aware also, if you, especially if you are having your own client in clinic, na you can determine, okay, how many pregnant client will deliver on that particular period. So on the part, and then on the part of the parent also, on the part of the pregnant client, so they will know it's part of their preparations financially, okay, emotional, and the rest of the preparations, that they know the expected date of delivery nila. So it's not the question in here, okay, it's talking about which of the following, okay, it's a probable that a sign that Mrs. Gaza is pregnant. Okay, so we're talking about the probable sign of pregnancy. On the probable sign of pregnancy natin, and the probable sign, okay, so we have three signs of pregnancy. We have the presumptive, the probable, and the positive sign of pregnancy. The presumptive, that is our highly subjective, least indicative of pregnancy that we have. On the probable, there are other conditions, okay, that may suggest that your patients, or objective siya, talking about the probable, but there are other conditions of which your patients may experience that manifestation. The positive, that's the confirmatory sign of pregnancy. And we used to have this, okay, the mnemonics, of course, we have this presume, okay, the mnemonics of presume, ang ganda na sulat ko, kakaloka. Okay? Okay, so we have the mnemonics, just the presume. Okay, so for the presumptive sign of pregnancy, letter P stands for the, okay, period absent. Okay, talking about amenorrhea. So amenorrhea is a presumptive sign of pregnancy. Another presumptive sign of pregnancy, it's the, okay, fatigue, really tired, okay? I'm so tired, So really tired, okay? We're talking about fatigue. And then another one is enlarged breast for letter E, so talking about the mnemonics of presume. And letter S, we have, okay, sore breast for your patient. And then letter U, urinary frequency or increase in urination, okay? Urinary frequency or urination increase. And letter presume, letter N, okay, presume, letter M, we're talking about movement of the fetus of the uterus as felt by the mother, and we used to term that as quickening. And okay, as early as on the 20th week of gestations, the mother used to feel that quickening natin. And of course, another one is, okay, emesis or the nausea and vomiting. So that's the presume. So that's the presumptive sign of pregnancy. Another one, we're talking about the probable. Ang probable naman, I'm using the mnemonics of the probable to determine, okay, using the mnemonics of probable. The first one, letter P. Letter P stands for positive pregnancy test. Okay, the presence of urine that accounts almost 99%. Okay, but there are other conditions, especially if the patient is having ovarian cancer. Patient is taking hormonal contraceptives that will give you a false positive result of the pregnancy test. Therefore, the pregnancy test of the urine is considered as a probable sign of pregnancy because it's not 100% okay, probability na pregnant na yung client natin. Okay, another one is the, okay, letter R, the returning of the fetus that we were talking about, the balloonment natin. Okay, so the balloonment or the bouncing back of the fetus when we do examination, it's considered as balloonment is considered. The returning back of the fetus is, okay, considered as a probable sign of pregnancy. And another one, it's outline of the fetus as palpated. Outline of the fetus as palpated, nakala mo ulo, yun pala ovarian tumor. So that's still considered as a probable sign of pregnancy. And letter B, we have the Braxton-Hicks contraction sign. This is a painless irregular contraction to prepare, of course, in a true labor contraction, but still, okay, there are other conditions of which your client may experience this possible contraction. For example, after the sexual intercourse in preparations for the in preparation for the passage of the sperm from the cervix towards the fallopian tube, the uterus tend to contract also. Okay, so that is considered as a probable sign. And another one is letter A, a softening of the cervix. We're talking about the softening of the cervix. It's the Goodell signs that we have. The probable sign, the softening of the cervix, and we have also letter B is the bluish discoloration of your vulva, the vernix, and your vagina. We used to term that the bluish discoloration as your Chadwick sign. Probable, okay, letter B, the bluish discoloration of your vulva. Okay, you have the cervix and the vagina. We're talking about the Chadwick sign, and the lower uterine segment becomes soft. We're talking about letter L, the lower uterine segment becomes soft. We're talking about the Hager sign that we have, lower uterine segment, the Hager sign, and letter E stands for enlarged uterus. Okay, it's not 100% pag lumaki na yung mattress mo, nabuntis ka. Okay, maybe you might have this uterine myoma, or the myoma, uterine na myoma pa, myoma, it's okay. We're talking about the myoma. So those are the probable sign of pregnancy. How about the positive one? On the positive one, the positive sign, that is the indicator 100% that the reason of the physiologic changes experienced by your client is pregnancy. Talking about there is fetus. Okay? May fetus na talaga si client natin for a while. Okay, so I'm using the mnemonics of fetus natin to describe the positive sign of pregnancy. In here, we're talking about the fetal movement felt by the practitioner, the nurse or the doctor. The fetal movement felt by the examiner that we have. Okay, so I'm using the mnemonics of fetus. Letter A, we're talking about the electronic device natin that detects the fetal heart sounds natin. The fetal heart sounds is detected by your electronic device. And you have also letter T, of course, the delivery of the fetus or the baby. The delivery, and you have the ultrasound that will detect the fetus. And then you have also the C, the visible. We're talking about the fetus, letter S. See the visible movement of the baby by the doctor or the nurse that we have. So those are different signs of pregnancy, from the presumptive to the probable to the positive that we have. So therefore, going back to the questions in here, so which of the following is a probable sign of pregnancy? Which of the following is the probable sign of pregnancy? So let's start with the absence of menstruation. So we're talking about amenorrhea, absence of menstruation. Menstruation is a periodic cycle, menstruation. And then amenorrhea is absence of menstruation. Another one we're talking about, excessive menstrual flow is your menorrhagia that we have. So absence of menstruation, positive, probable, or the presumptive sign of pregnancy. Therefore, in the process of eliminations and the application, so this is a presumptive sign of pregnancy. Presumptive sign. Okay, how about the softening of the cervix? Softening of the cervix, we're talking about the Goodell signs, and this is the probable sign of pregnancy. Okay, the softening of the cervix. Okay, you have also nausea and vomiting. This is a presumptive sign of pregnancy using the mnemonics of presume. That's letter A. We're talking about emesis and nausea. Okay, so this is a presumptive sign of pregnancy. And letter D, breast changes also. It's another presumptive sign of pregnancy. So the three except letter B are presumptive sign of pregnancy. Again, we're using the probable as our mnemonics also to describe the probable sign of pregnancy that we have. Therefore, the correct response for this question, we have the softening of the cervix as the probable sign of pregnancy. Okay, next we have another situation. Okay, we have a healthy, thriving 4-month-old boy suddenly experienced episodes of acute abdominal pain. Okay, acute abdominal pain. So the infant is admitted to the hospital with a diagnosis of intussusception. So intussusception, sabi natin, in our pediatric complications, so intussusception is invagination of the intestines towards itself. That causes, of course, as the intestine invaginates, what will happen? The area on invagination will cause increase in pressure. That causes, of course, that increase in pressure nagkakaroon ng the mucus formations of which it will give us, clinical manifestation of current jelly stool, a current jelly stool. Okay, on intussusception, so you have the type stool that we used to observe is the current jelly stool that we have. So, ang ginagawa, the usual management in order to address, we can have this ultrasound to determine, of course, the degree of intussusception, and we can have also this barium enema, but the danger in the barium enema is the perforation of the intestine that can cause peritonitis that we have. But this barium enema, aside from determining the problem or as used as diagnosis of this intussusception, this will serve as also as treatment of the condition. Treatment of the condition. But the usual treatment for the intussusception, aside from the barium enema, you can have the surgery. Okay, the surgery natin, surgical removal of the invaginated na intestine of your patient. So what will happen to this patient? Okay, this is the question. Okay, para magpatuloy ako, we have the question in here. Okay, nauna pala tong options natin. Okay, so dapat nahuli to. Sige, tingnan natin. Constantly and extending his legs. Okay, intermittently and drawing his knees to his chest. Okay, it's really when ingesting food, and intermittently when positioned in his left side. So an interview with the nurse, the infant must describe. So we're talking about anong ine-expect natin. Kasi we have this patient talking about intussusception. Anong kaibahan? So ang itong common questions talking about the GI and the board examinations, another one is the hair-sprung disease. On hair-sprung disease, aside from ito yung mga laging tinay, the hair-sprung, the intussusception, the esophageal atresia that we have in the tracheoesophageal fistula. Okay, so on the hair-sprung naman, this is absence of a ganglionic megacolon that we have that causes, of course, inability of the stool to be magpapass directed towards because of the absence of that cells natin. So in here, talking about an interview with the nurse, so we expect, for intussusception, constantly and extending his legs. Okay, ano on our assessment, for us to know that the patient is having this intussusception. In intussusception, there is an episode of, nagkakaroon ng episode ng attack of which the patient will experience severe pain. And because of that severe pain, kaya intermittent, so the answer in here, kindly type in your answer. Try to draw his knees towards the chest, and there is episode, so intermittent. Kasi episode of an attack that we are talking about, the pain experienced by your client. So intermittently, and drawing his knees, it's not when positioned in his left side. So letter B and titingnan natin because it's not constant. Because the child used to experience at least mga 15 minutes, nagkakaroon ng attack talagang sobrang iyak ng bata, tapos pinupul yung legs towards the chest, akala mo ikakamatay na. That's usually, it will last for 15 minutes. Then after that, after that attack, back to normal, masaya na naman yung bata, parang wala na namang nangyari. Okay, so that's how we are going to assess for patients with intussusception that we have. So intermittently and drawing his knees to his chest. Okay, next situation, we have Mining claims to be amenorrheic for 1 month, and then she consults at the lying-in clinic. Amenorrheic, so the absence of menstruation for 1 month. Okay, so here's the question. What hormone is excreted in the urine that serve as the basis for most tests for pregnancy? Okay, most tests for pregnancy. So alam na natin to. Okay, these are the questions. Nasabi nga natin, questions that you really know. The questions that you really know. So yun ang uunahin natin sagutan. Yan, alam agad, wala pang option. Answer somebody, answer HCG. Okay? So pag during the board examination, yun ang uunahin natin for us to know. Okay? Meron naman tayo dito during our midwifery board examination, because I am a nurse midwife, midwife and nurse in a ladderized curriculum. Ang paborito kong subject when I was a midwife is talking about professional growth and development. So the PGD. On the professional growth and development, talking about the subject. So yung questions when I took the board examinations, when I applied, eto yung alam mo na kaagad na, ay, ang taas ko dito. Kasi ang sigurado ka, pwedeng magkaroon na lang ng technical something like that, na 90 questions out of 100, parang sigurado kang kaya mong makipagdebate dun sa lecturer mo kung hindi tama yung sasabihing sagot based dun sa question mo. So these are the questions somewhat like this. Also in human chorionic, wala tayong pagdidebatihan dito. Maloka ka kung sasabihin ko estrogen yung sagot. Okay? So mahaba-habang debate yon. So in here, so these are questions that we really know, so you are going to answer it. Okay? So 1 second, 2 seconds, but you really need to read back except or may kung anong question. Another one is the follicle stimulating hormone. Nasabi nga natin, this follicle stimulating hormone is responsible for the maturation of the primordial follicle that we have too, the Graafian follicle that causes the final maturation of the ovum through the help of the luteinizing hormone that we have. Progesterone is the hormone released by the corpus luteum, and then another one you have this estrogen. Okay, this is from the Graafian follicle that we have, of which we that one as sabi natin hormone of women. Therefore, the answer, okay, this is our basic question. Answer for this is the human chorionic gonadotropin. Okay, very good, very good, very good. Next, moving on, okay, you have this woman, 26-year-old, gravida 2 para 1 full term, is rushed to the emergency room due to the passage of a watery vaginal discharge. Nagwawater-water. Okay, watery vaginal discharge. Okay, so going back in here for the question, which of the following, titingnan natin dito sa situation, the passage of a watery vaginal discharge. Watery vaginal discharge. So we might suspect that the patient experienced while reading the situation, okay, pumutok na yata yung panubigan. Okay, gravida 2 para 1. The concern, full term naman. So pumutok na yung panubigan. Okay, so yun munang iisipin natin. So the passage of a watery vaginal discharge. But how are we going to know that the patient, okay, experienced this rupture of membrane? Okay, so ang daming examination. It can be through internal examination or through the, okay, you have the nitazine paper test or the Ferning test that we have. Okay, so the next question, for the question, which of the following interventions will be the immediate action of the nurse? The immediate action of the nurse. Upon knowing, Mrs., ano pong ginagawa nyo dito? Nandito po kami, okay, sabi, full term na ako, 39 or 40 weeks of gestation, okay, kasi may lumabas po na tubig sa, okay, puwerta ko. So what is your immediate action as a nurse? What is your immediate action as a nurse if that is the concern of your patient? So let's take a look on the choices. Letter A, take her fetal heart tone. Letter B, monitor her vital signs. Okay, letter C is start intravenous fluid. And letter D, place her on a left lateral position. So what is your answer? Place her on a left lateral position. Okay, which of the following? Type in your answer on the following interventions, knowing that the concern of the patient, she experienced this, okay, pumutok na yung watery discharge. Okay. So, letter A, very good, very good. Okay, Marco Padora, very good. Okay, Patricia Ramirez, very good, very good, very good. So we're talking about the following interventions, immediate action of a nurse, because we need to determine. Okay, so we might suspect that the patient experienced rupture of membrane already. So paano natin malalaman na nagkaroon ng complications? Okay, putting the patients in the left lateral position is a good intervention. But after we know that the patient has, okay, gawin na lang muna natin sa tayo mag-check ng fetal heart tone. Paano kung nandun sa kabila yung fetal heart tone, hindi mo natuloy na check kasi pinaposition mo in the left lateral position. This left lateral is a good position talking about uterine insufficiency that we have. Any condition of which compromise yung oxygenation status ng fetus natin, napakagandang ilagay siya sa left lateral position. But the question is immediate action of the nurse. Okay, so we are going to take the fetal heart tone first. Kasi if that is increased or decreased, it may suggest fetal distress. So pag may fetal distress, so we might suspect that the patient, kasi baka naglakad pa, sumakay ng tricycle, okay, nung pumutok nung lumabas yung tubig, pinalakad ng asawa, kasi ayaw na siya, maglakad ka, wag ka mag-inarte, kasi pagdating sa ospital, papalakarin ka rin. Pinalakad, okay, hanggang makarating sa tricycle, pagbaba, naglakad ulit, papunta sa emergency room. So we might suspect that there is, okay, prolapse of umbilical cord. So therefore, we need to check to ensure that there is no complication because of that rupture. Take the fetal heart tone of the patients. Very good. Lahat tama yung sagot. Very good, very good.